Hello, everybody. Can you all hear me?
Yes, I can.
Perfect. Well, good morning, everyone. My name is Jeff Javier, and I'm the marketing specialist for the Sonoran UCEDD at the University of Arizona in Tucson. Thank you all for joining us for the Adapting Virtually to Provide Employment Support webinar. Just a few housekeeping notes. Please hold your questions for our presenters until the end when we have our discussion session. For that discussion session, please type in your question into the chat box or use the raise hand button function. If you can't see the raise hand button, it's if you click on the manage participants button at the bottom, you should click that, and then it should appear on your right hand side, and the raise hand button will appear above the chat box. And for those attending via phone, you can also raise your hand by pushing *9 on your keypad. And so without further ado, I will introduce Wendy Parent-Johnson, the Executive Director of the Sonoran UCEDD. Oh, yeah.
If you could get that to them, that would be great. So thank you everyone for joining us. We know this is short notice. We wanted to bring everybody together and see how we can address the needs for employment supports in the state. We have some great speakers. I know people are doing things. So we wanted this to be a platform where we can start the conversation, where we can share ideas, and where we can identify areas where we can help support all of you with what you're doing out there. So I so appreciate everybody joining, and we are going to be recording this, correct, Jeff, so that we can share it with others that aren't able to attend, or for other people in your organizations, if that's okay with everyone, just so you know in advance that we'll be doing that. So I'm going to move forward and get started with the content today and the discussion. And so I'm going to turn it over to Susan Verall, who is going to get us going here. Susan? Oh, she must be, you don't show up as being on mute, Susan, so.
Susan? Please excuse the technical difficulties.
Okay. Well, I can jump in if you want.
Yeah, please do.
Okay, let me just jump in real quickly, and then Susan can come back on. We are so grateful for everybody. We have all of our state agency partners on. We have a lot of the providers and people that are delivering services, and so this will be just such a rich discussion, and we truly appreciate everybody joining on such short notice and pulling this together so quickly, and sharing all of their the opportunities that are available to us. And so we are going to get started. And first of all, I want to introduce our guest speaker, Julie Christensen, who's the Director of Policy and Advocacy with National APSE, the Association of People Who Support Employment First. Julie is just, she has got her finger on the pulse of everything going on related to COVID-19 and employment services. In fact, let me just tell you, the last week she spoke and updated all of us at the National Employment Special Interest Group that we run for our UCEDD, our network. Before I could get the minutes out, she was already sending new updates for me to include and change the things we had just talked about. So that's how current she is. So she is here today to share with us some current activities at the national level, at the state level, some things that other states are doing related to virtual supports and other ways that they are delivering services. So basically everything you want to know about employment in real time is coming from this person. So Julie, thank you so much for coming and talking with us, because I know you're being pulled by everybody to help them out at each state. So thank you, thank you.
Oh, thanks for having me. Can you guys hear me?
Yes.
Yes.
Awesome. So Wendy is a little bit overly effusive in her praise. I caveat everything I say these days with, I can't guarantee that what I say right now is accurate, because that is how quickly things seem to be changing. But Wendy had asked if I could just give a quick update on where we're at in the various stimulus packages related to COVID-19, specific to employment supports, what it means for us, and then kind of what's happening next. And so I will caveat this discussion that the rumor is that there is going to be a COVID-4 package dropped today by the House. So again, this could be moot by the end of this conversation, but probably not, because sadly I'm not as cautiously optimistic as I'd like to be, and so certainly we're going to need some more advocacy. But let me just kind of back up to give kind of a lay of the land on sort of where we're seeing things nationally, and every state is different. So I know, Wendy, I think you have folks from your VR and DD agencies on, and so if I say anything that doesn't ring true for Arizona, please know it's coming from a 30,000-foot national view, and there are states doing some really impressive and innovative stuff in the midst of quite a bit of confusion. But so the two systems that we're really keeping an eye on are, not surprising, Medicaid and vocational rehabilitation. So what happened relatively quickly by systems timelines is that CMS provided quite a bit of flexibility around telehealth. And so because of that, long-term services and supports funding for employment has had a jump start on being able to be responsive in the employment sector much faster than what we're seeing in vocational rehabilitation. So, this is one of the times that having long-term services and supports funded in the same conglomeration as healthcare actually benefited the employment sector, and at least being able to do some work in transitioning to kind of a remote supports capacity. So that being said, there's not enough money in the system arguably to begin with, and we've faced quite a workforce crisis shortage for direct support professionals in general, as well as employment support professionals who fall under that DSP umbrella, even before this. And we sort of kind of hit a perfect storm, because as various states and localities were going to shelter in place, and there was a lot of confusion about who could do what we saw was just kind of a giant timeout for employment supports broadly, as everyone kind of regrouped to try to figure out what they could do. On the Medicaid funded side, we are now seeing services resume, lots of creative use of technology to provide remote support. CMS has been pretty flexible in what is allowed and billable. But part of the issue is the job market has also changed. So supported workers, there's kind of two pieces to this. If you think about being a supported employment agency and the array of individuals that you serve, certainly a number of supported individuals have been impacted by layoffs, furloughs, jobs closing, and then that trickles down in terms of what providers, the availability of billable hours for providers, right? But simultaneously, we see a lot of supported workers who are still working in essential jobs, whether it's our grocery stores, our retail distribution centers, healthcare, there a lot of the essential businesses that remain open have traditionally been sort of at the forefront of hiring people with disabilities, and so there's a critical need to make sure that folks have the supports that they need in order to adapt to changes in processes, which are rampant around different ways we do business, and grocery stores and disinfectant and this, that, and the other thing, as well as just the anxiety of having to go out to the job, in the midst of a pandemic. And so the first thing from National APSE's perspective we did was jumped on trying to get employment support professionals classified as essential staff. We're continuing to do that advocacy at the federal level, but really that's a state issue at this point. States can determine who their essential staff are. And so that's a big advocacy piece for us at APSE, is to really try and make the case in states to make sure that employment support professionals are included. Part of the package 3, so so there have been 3 stimulus packages on COVID-19 to date. The first one was just kind of an influx of dollars very quickly. The second package was the family's first package. And then the latest news is the CARES Act, which is the $2 trillion stimulus package. We were doing a lot of work there to try to get increased HCBS funding to states to open up the array of supports and services that could be offered. We were not successful in getting that. What we were successful in getting in package 3 was making sure that people with disabilities who are furloughed have access to the same benefits, the either uninsurance benefits or the stimulus checks, and so on and so forth. And so there's a lot of work being done right now around what that means for benefits. I will quickly say that the quick answer to that is that whether you are applying for disaster unemployment or you're receiving a stimulus check in the mail, they are not counted as earned income in terms of people with disabilities and their SSI, SSDI benefits. There's more nuance to that, but that's kind of a broad statement that we're really just trying to get the message out that people with disabilities should be encouraged to take advantage of the array of options that are available. We fought hard to make sure that that was a factor. The other thing we got into the bill, which I will say with some caution, is the allowance for not-for-profits, including those who already receive Medicaid funding, to be eligible for Small Business Association loans. This isn't a fix for everybody. There are some limits on 500 people or less, but what it does open the door for, we were quickly seeing a lot of smaller providers all around the country laying off their staff and closing their doors because dollars weren't flowing. It's going to be a while before we catch up, and we know that the not-for-profit provider community is not likely to have large stores of emergency funds to fall back on in order to pay your your salaries and your electricity and so on and so forth. These small business loans are available now for not-for-profits to be able to pay for all of those things. They will be forgiven, so it's essentially it's free money. The problem is going to be getting access to those funds. And so we're really encouraging folks to stay in contact with your Treasury folks in terms of how this is going to be implemented. And we're still not 100% sure how that's going to play out. But at least that pot of money is eligible. There's also a discretionary fund in the package 3 that is pretty broad, that allows states to just basically draw down additional federal dollars for emergencies, and vocational rehabilitation and the DD agency in your states are eligible for those dollars, but you're competing with every other state organization, state agency in your state. So we're certainly trying to get that message out so that directors of VR and DD services are able to do the advocacy within your state infrastructure that you need in the event that your state is intending to take advantage of those dollars. So that was package 3. So some really good news, but some not great news, especially around the Medicaid funding for home and community-based services. So that is our huge push for package 4. And as I said earlier, the rumor is that the House is going to drop a draft bill today. we did a purposeful push, and I know it got to Pelosi's office last night. What is going to happen to it, who knows, to make sure that all language when we refer to direct support professionals is inclusive of employment supports. So that's not always the interpretation. There's a lot of emphasis on healthcare and home health aides and personal care attendants, and we want to be very clear that the language around home and community-based services includes employment, and to make sure that if these grants are offered to states, that employment services have access to those dollars as well and are prioritized. A big piece of our push, and I will be honest in saying it is difficult in this political climate to get employment embedded into some of these conversations, because there's so much to take on. Healthcare is taking up the majority of the space in conversations. And so, the more voices we have talking about the fact that one of the fastest ways for our economy to recover is if people are working. And right now we actually have critical jobs that can't be filled. I was talking to a provider in North Carolina yesterday who said her phone is ringing off the hook with businesses who are desperate to hire and know that their partnerships with supported employment professionals is a prime opportunity to get additional supports and to get people into these jobs and onboarded quickly during this crisis, but providers simply can't because they don't have staff to be able to make that happen. What a tremendous missed opportunity for Employment First. So we're really trying to push the envelope here that, healthcare is absolutely important, but thinking that, we'll get back to employment when we're in recovery mode is going to be too late, because the fear is that the employment service infrastructure won't be in place to be able to help people when we get to that point. So the HCBS funding is a big piece of it. We're also trying to work on, under that umbrella of employment support professionals, our direct support professionals, all of the advocacy around things like hazard pay, increased hourly billable rates for DSPs during this time. We're working to ensure that that includes employment specialists as well. And I think those are the major advocacy pushes federally. I'll quickly say that I mentioned the ask for states, for advocates in states to talk with your governor and your legislators about designating DSPs as essential workers. The other piece is that there is quite a bit of flexibility within what your state Medicaid and operating agencies are able to do as well. So some things that advocates can do is ask for increased rates, ask for clarification around what allowable services qualify for reimbursement. That's something that a state can change within the auspices of the greater flexibility that CMS is providing right now. Things around guidance on reporting and accountability measures, those are things that can be negotiated with states right now, again, with CMS providing some flexibility to do that. And also guidance around allowable service modifications. So remote supports are a big conversation right now. And states are able to take advantage of the allowances under telehealth to transition that to tele models of employment supports. That's not something that states need CMS's approval for. That's already been given. It's a matter of state agencies providing guidance for providers on how and what those infrastructures should look like. Let me talk about vocational rehabilitation, because that's not as that's a little bit more difficult of a situation. So unfortunately, we are seeing states where vocational rehabilitation has largely kind of shut down, waiting for federal guidance. The Rehabilitation Services Administration, RSA, has not issued any direct guidance to state vocational rehabilitation agencies, other than to say that the Rehab Act is the authority and that we need to be operating within that. So we've been working with RSA to try to get the right talking points out to states. And really the message to VR directors is that it's within their purview to look at service definitions and to make sure that there are options for billing that might look a little different than the way services are typically provided. That is absolutely within a state VR director's purview to do that as makes sense for your local context, but getting VR dollars flowing is going to be really critical for the provider community, especially because we already just discussed some of the challenges around Medicaid LTSS services. We are advocating in package 4 to waive temporarily the state match requirement for vocational rehabilitation dollars, allowing states to draw down the full amount, whether or not states are able to match it at this time. Keep you posted on how that goes, but that is something that we are actively working towards, just doing everything we can to keep the employment services infrastructure intact as best as possible during this period of time. I think those are the main updates. Wendy, is there something I'm missing that you were hoping I was going to talk about?
No, I think you covered it. The next piece we wanted to move into was virtual supports, virtual employment support. So
I will, if I can take a quick second, because this is super cool. I just want to give a shout out to Washington State, which, if you're an employment first enthusiast, Washington has been doing this work for a very long time and have such a great infrastructure. But I was on the phone with Washington folks yesterday, and what they're unique truly in the country. Their VR and DD services together have issued a temporary list of allowable billable activities that typically wouldn't be billable during this period of time for the purpose of keeping people whole. So the goal was to make sure that job coaches, job developers were not getting laid off. So things like you're doing your CEUs, anything related to CARF accreditation, you know, all of the stuff that people have to do but are not typically billable hours for VR or Medicaid. They are allowing those to be billed at this time. They looked at what billing looked like for a 2-week average prior to when the COVID-19 pandemic started, to figure out what amount of money agencies were typically receiving, and that's what they're committing to continue to allow agencies to bill as long as staff are doing activities within this allowable list. Such a cool, innovative way of thinking about how to keep folks, you know, working and ready and able to, you know, jump right back into services and business as usual when we get to that point. So I'm just going to keep telling that story to anyone that will listen, because they are about, you know, it's about the best scenario I have heard so far around the country.
That's excellent. That is creative. Do you want to talk about the virtual supports using the technology like the iPad and texting that we did for the test project?
Yeah, jump in, Wendy. So it just so happened that Wendy and I and some folks in the Midwest have been working with the Kessler Foundation on a pilot project looking at the impact of virtual supports for job coaching and job development, recognizing that the rules at the time were in many places that virtual supports were not billable. They were not viewed as best practice, so to speak. A lot of concerns about, you know, privacy and this, that, and the other thing. And so we happened to be working on this pilot, which was just great timing because now there are no rules, quite frankly, and we're able to talk about the ways in which technology works and doesn't work. And we are seeing more and more states start to put out lists both through Medicaid and through VR about what services are allowed to be done remotely. The lists are pretty broad and varied. So, you know, it's not just being able to pick up your phone or your iPad and remote support somebody who is working in the field. You know, obviously that's huge for shelter in place. It's also great for, you know, just trying to keep the spread down because we're able to minimize the number of times job coaches need to actually go out in the field, you know, as opposed to when there's something quick that can be dealt with virtually. A lot of flexibility for things like that, but not just for job coaching. We're seeing states that are allowing virtual job development, discovery services. You know, there's a lot of things that people can be doing through the use of technology, much of which is free. I will say that for Medicaid funded services, simply because Medicaid is also healthcare, there are some HIPAA guidelines that folks should be aware of and make sure you're operating within your state's purview. On the vocational rehabilitation side, however, there should not be a HIPAA issue with providing remote supports. And yet we are seeing in some states that that has been a barrier to providing remote supports, is being concerned about, well, is this platform HIPAA compliant? There's no health information being shared when you're job coaching. And so in the VR world in particular, that's something that should not be a barrier. And if folks are hearing that it is, please let us know so we can try and get the right guidance to you.
Mm-hmm. So, you know, just to share and build on that, thanks, Julie, briefly, some of the states on that project that we had were using iPads to deliver direct employment supports. Others were using phones to provide texting support. And we found the data showed that people we had successful outcomes of both achieving employment and maintaining employment. So job retention was a big piece of that. And so I think if we look creatively, and especially with our state agencies supporting, which they'll come on soon and talk, how can we best deliver this? And one of the things that I wanted to throw out there is that, I don't know if you all are familiar with the National Core Indicator data, but this is collected across all the states and looked at. And one of the data points that they sent out, I think yesterday, was that only 56% of this randomly selected sample of people with disabilities have access to cell phones. And out of that, 44% of them would like one. One of the things that we've also been looking at internationally is how are we going to have people interact in the business world specifically, but just in generally, if we're not providing them with the technology. So is this an opportunity for us? And could that be something that is purchased, like a cell phone with a what do you call it? Not the data plan, but where you buy the minutes. We did that in one of the states I worked in. Before the whole idea of virtual supports, it was done in a different capacity, but Voc Rehab did support purchasing the phones for people. So is this a way we could be creative now and address the needs that people with disabilities are saying they don't have access to, that they would like access to, build a community of support around them to be connected to the world, but also allowing us to provide that support on the job? So it's just thinking of things like that in this current time that we can consider. So I don't know if Susan is on now, because that was, we're going to the next piece.
Can you guys hear me?
Yes.
Okay. I'm afraid to show my camera because I don't know what's going on with my Zoom. I use this every day, so I'm not certain, but we'll work through this. Thank you guys for your patience. I'll just go right into, it kind of lends itself, the next piece is to hearing from our state agency representatives that have been so willing to collaborate with us on this. I think and it'll lend itself to what we were just talking about. We'll let Krista Mackey, the administrator for Rehabilitation Service Administration, or VOC Rehab, talk a little bit about what they're moving forward with and allowing for virtual services and billing. And then when she's finished speaking, Nicolette Fidel, the Deputy Assistant Director for the Developmental Disabilities, Division of Developmental Disabilities, my apologies, we'll talk about the DDD piece. And then Adam Robson from Access is the Employment Administrator, and we'll let him tell us a little bit about what our state's doing in the Medicaid program. So Kristen, if you want to go,
sure.
You're up.
All right, thank you. Can folks hear me?
Yes.
All right, perfect. Yeah, it's great to hear from Julie and hear some of the other opportunities. So scribbling down what other states are doing. When we started this, I did put out an email to our staff and just said, I want our staff to be as flexible as possible in providing the services. So knowing that remote services are going to be the way that we need to start moving forward, I need you as staff to be flexible and allow that as an opportunity. So that was sent out to our vendor staff. It was sent out to our staff as well. We said we recognize that some services may not lend themselves to virtual right at this point, but as people are working through it and as they're learning more, we may move into that. We've had a couple of folks say, hey, I really think I can do this service virtually. Would you allow it? Because it's not in our contract right now that it can be done that way. So we're making notes where we're saying, yes, go ahead and try it. Let's do it. I'm kind of keeping the list of business decisions that we're making and those kind of flexibilities we're allowing so that we can make sure from a contract monitoring perspective in the future, audits, those kinds of things, we don't want to get ourselves in a sticky wicket. We just need to make sure that we're noting that. So I encourage all of the vendors to contact us. If you're thinking about, how can we do this? Just let us know so that we can make sure that we have notes on it and we're keeping our due diligence tracking that. But we are all trying to move, and how do we provide the services virtually? So our staff at VR, we are providing services remotely. Probably as of Monday, most of our services in offices will no longer be available. The department is shifting to try to get as many people out of the work, out of the office spaces as possible. But we're lucky in that all of our services can be provided virtually in some fashion. I know that some folks may not be able to get a hold of us, so there are some resource rooms that are going to be available still at the DES offices. They're going to be slammed and crowded because of all the UI, people there. So there will be wait times. And we're, the thing on the phone was, buying phones for people. We kind of had already started talking about, what would it cost to buy a bulk of burner phones in some minutes? How do we do that? And then how do we get them to people? So those are conversations we're having. We don't have firm answers on that yet, but we're trying. We're working through some of those logistics. All but probably 36 staff have the equipment to work from home. So we have provided external access to our case management system. So authorizations, IPEs, changes in service delivery models, all of that stuff can be amended on the fly from a remote service. So if your clients are needing changes, if you as a vendor are needing changes, continue to contact your counselors and ask for those changes. So, even though they're working remotely, we have put out there, you're still required to call people back. You're still required to call your voicemails and check that. Everybody can get to their emails remotely. So that is something that we are managing with our staff as well. The only caveat to what is, and it's unfortunate we had to do this, if we are moving to doing virtual service provision, the authorization line item for our disability related employment services just needs to change to facility based. It can't stay as a distant, I'm driving 50 miles to go provide this service. That's the only change we're asking for. So if you're having a hard time getting that from your counselors, pull up the line. Visitors, let us know. If you're hearing things in the field like they're saying, oh, I can't do it because I can't get a signature, that's not the case. We have provided additional guidance to our staff to say, we know electronic signatures are probably not going to happen right now. Make good case notes, make sure you're explaining the service changes that are happening in your IPEs, and we're allowing those verbal authorizations to happen at this point just to facilitate and expedite the changes that are needed in order to provide the services. Just two last bits is have said, do not close cases if clients are not calling you back right now. You know, we typically have this, you're not engaging, you're not participating, you know, you have 15 days to call us back or we're going to close your case. We've said no more of those right now. People are managing as best they can, and I don't want to close cases because they are not rapidly returning phone calls. We know that folks may not be able to at some point, you know, or they can't get to a computer, whatever. So don't close cases because they're not calling you back. And then also, if we have our clients are currently working, we have, you know, our 90 days, our 180 days, and we make sure they're stable, and then we're going to move them on. I want to make sure that we're going to be flexible with that timeline. So we are kind of lifting our regular cadence on, you know, are you at your 90 days? Are you at 95? You know, what are you doing to kind of move this client into being self-sustaining and supported, even with, you know, extended services? We're going to keep that open. So we want to make sure that the services are still available to people if they need supports through this time frame. So extended supports, job development supports, those things we anticipate seeing an increase in the number requested from vendors. And I want those to be authorized and move ahead so that we can keep people that are currently employed still employed. That's the goal, right? We don't want more people hitting unemployment. We need people to maintain their jobs, and we should be providing the services to do that. Job development and placement services can still occur now. You know, people are thinking, oh, nobody's got jobs. There's a ton of people looking for workers. If folks are willing to work and able to go out and search for work, let's support them in doing that. So those kind of where we're at from a VR perspective. Still always looking at, you know, how do we help support providers and our staff and clients, and making sure everybody's safe. And that's the biggest concern now, just the safe provision of services, but knowing that there's lots of ideas that we can explore, and we're certainly willing to be flexible on that too.
Hey, very quickly, we can see it in the chat. Someone is not on mute. If you guys can please make sure you're on mute. Unless that was Kristen, although I'm not certain that it was. We were trying to look through to make sure people are muted. We can hear shuffling of papers. It's very interruptive. Thank you all. Thank you so much, Kristen. I did see a few questions come in, so in a little bit, at the end, we'll try to get to those. Yeah. Nicolette, I see you're on. If you are ready to do your updates, we would appreciate it. Thank you so much. You will have to unmute yourself, Nicolette. We cannot hear you. Jeff, it's saying that Nicolette, I don't know, it's Nicolette Fidel. You may have to unmute her.
She is unmuted. Let's see.
I don't know, that might be the same problem I had. I had to call in Nicolette using the phone number and the password to be able to hear me. You may have to do that. With that said, maybe while she's doing that, Adam, are you able to, can you try to, so that we can try to go into you real quick, access his updates? Oh, Jeff, it's telling them that the host has to unmute them.
Hey, Adam, you should be able to talk now.
Can you hear me now?
Oh, yeah. Thank you, Adam.
Hello. No problem. Hello, everyone. Adam Robson, the Employment Administrator over at Access. couple updates for you on this is most of our access employment billing codes are temporarily available via telehealth. So the audio video component of that during these COVID-19 times. And once it's determined that we're past these times, those codes will revert back to the normal billing. We truly are trying to accommodate everyone during these times. And when I talk about those billing, the employment billing codes, I'm talking about for behavioral health, we're looking at the H2025, the ongoing support to maintain employment, which is already available telephonically anyway. And also the H2027, the psychoeducational services, the pre-vocational code. We moved that to the permanent list, which is kind of weird on its own that we're calling it that. But the permanent lists are these lists that we're allowing for telehealth for the audio and the video portion of it. And so the H2027, the pre-voc code was moved to that list on April 1st. And then the T2019, the habilitation supported employment for long-term care, DDD, has also been moved to the permanent list as of yesterday. So for our three main employment codes there for the H2025, 27, and then a T2019, we are allowing telehealth to be billed. And when I said earlier, I said most employment billing codes, I know that for behavioral health, the H2026, which is the job coaching code that is per diem, is not being allowed right now, which is obviously understandable, which is over 8 hours time there per diem. For any updates related to all of this, please refer to our website. On our website, there is up at the top of the page, we have a COVID-19 link. Click on that, and then you'll go to the FAQs. That's a way to stay informed about what's going on with what we're doing. And then also on our website, we have would it be easy for me to show people how to get to it on the screen potentially, or just give the long link for the website? What do you think, Susan?
Probably due to time, if you could put the link in the chat, and we will make sure everybody gets it. If we have more time at it, I would let you do that, or we would let you do that. But I think,
perfect.
Yeah.
Perfect.
Thank
because
you.
I know our website, just like any other state website. Sometimes it's difficult to navigate, and so I just wanted to show you so that you can get a visual of it. But we do have an Excel document in there called a telehealth code set. That's the one we're relying on for the most recent changes and everything. If you have any questions around coding, or and you want more clarification or anything, I ask you to please speak for the providers out there. Please speak with your own coding department or your contracted MCO coding department. And if those do need to be elevated, either you or the MCOs themselves, they may reach out to our coding department. We have a website listed in the FAQs, and that's just coding policy questions at azaccess.gov. And then last for me is, I know probably I haven't looked at the chat, but there's probably some questions in there already about it, but I know there'll be questions around rates. What are the rates of these temporary usages of telehealth? I have been directed to have you contact your own rates department or your contracted MCO rates department for any of these questions. We are still, when I say we access, we're still not in the business of answering provider rate questions like that. So that's between the providers and the contracted MCOs. That's all I have. And then I will copy paste those to the website in there, and then also the email address for the coding policy questions into the chat.
Thank you so much, Adam. We believe that Nicolette is now off mute. Sorry about
Good
that.
morning, everybody.
Oh,
that's okay. Good morning,
you.
everybody. Can you hear me? Hi.
Yes.
So I'm Nicolette Feidel. I'm one of the deputy assistant directors with DD. I support our network operations, and we've made, as you can imagine, some significant changes in our service delivery and implemented some systems that I think will be helpful for folks on the phone to know generally, and then how it impacts employment services. So DDD has its own COVID-19 website. We are updating FAQs almost on a daily basis about all kinds of service delivery changes that we've made. We did create on March 12th a system for our vendors to submit requests to change their service delivery through our quality management team. That's being triaged through a team of network, support coordination, quality management, and our healthcare services to really be flexible and provide support to vendors when they need to make changes to their programs to support telehealth, social distancing, and other accommodations. We've had the opportunity to quickly upline telehealth services for therapy, our intensive autism services, and our rehabilitation music services over the past couple of weeks, and are in the process of working on our coding so those can be paid out. We also, on beginning of this week, I believe Monday, Access opened additional habilitation codes, which are the codes that we use for our employment services and supports. We have a team of staff who are working on reviewing our contracts to look at components that we may need to suspend in order to deliver telehealth service. And then we intend to provide both billing and written guidance for our day services, additional habilitation services, and our employment services, so that everybody's really clear kind of about what we see as best practices, at least for the time being. We'll post those guidance documents on our webpage probably the middle of next week, and they're going to be fluid. I think we're learning a lot through delivery of other services, and so we anticipate changes. So we'll ask that you please review our website on a regular basis so that you have information about the changes we make them. Also, there are a lot of guidelines, protocols, and procedures just about general cleaning, sanitation, and other guidance that will be helpful for all lines of business. And we have a mailbox to accept specific COVID-19 questions and questions from providers around service delivery around the COVID-19. We've also made changes to sort of certification and training requirements as things are expiring. We've made some allowances to continue to ensure that our direct support professionals can work, including those who provide employment services. Let's see, and there's some additional guidance on our webpage around essential services, which would identify all the services that we provide. So there's links on our website to our own COVID-19 guidance documents, as well as the Department of Health Services, CDC, and the coronavirus website as well. Are there questions? Oh, I was going to say one thing to what Kristen said. What we actually stole or borrowed from another state, I think it was Oregon, or it could have been Washington, is they determined that it was appropriate to post kind of a decisions list. And we took a similar approach so that we could track those decisions and where we created flexibilities and allowances and what date we made that determination, so that when we go back and sort of unwind some of these flexibilities from an auditing or monitoring perspective, everybody will kind of know when those activities started and when they stopped. That's also available on the DDD website.
Oh my gosh, thank you so much, Nicolette. Because of time, we are, please put any questions in the chat box. What we'll have to do likely is compile those and ask our state agencies or appropriate folks to help us answer those, and then we can get some answers out to you if that's the case. Thank you so much to the state agencies. That was my part in the beginning, to just make sure that you all knew how collaborative everyone has been and how quickly we pulled this together. So with the last 11 minutes, we kind of hoped for a little more time, but that's okay. We'll kind of combine the last couple things between Wendy and I. We're just hopeful that some of you might quietly unmute and ask and help us understand what some of your agencies may already be doing and allowing for virtual services, and anything that you guys want to share. We know that it's all happening so fast. What would you like to know? What have you kind of experienced already? Challenges, barriers? We're really hopeful to use this last 10 minutes it can really help us to think about what we might need to provide in the future, depending on, it could be anyone, Sonoran UCEDD or Voc Rehab, et cetera. So we want to open it up to hopefully folks will be willing to do that for us. And if not, I may call on some people I see that I know are doing some great things. So.
Jeff, are you managing the, if people raise their hand, or how are you doing this?
Yeah, we have James Sobo who's raised his hand. He can ask his question.
Thanks.
Okay, can everyone hear me?
We
Yep.
can.
Yeah.
Okay, great. All right, I just want to review some of the stuff. I'm with West Yavapai Guidance Clinic up in Prescott, Arizona. So in regards to the stimulus, I think she had mentioned the original speaker, the first speaker, that people that are on SSI or SSDI benefits are or are not eligible for stimulus. I believe she said that they are. I'm under the impression that people have to file taxes to get a stimulus.
Was that for Julie Christensen? Oh.
Yeah.
I can.
Yeah.
I know there's been the ARC and John Myers group here has put out a sheet, and Julie has as well. My understanding is they are, but I can get that officially from her, and the documents that would be helpful.
No problem. Yeah, a few of my questions are for her.
Mm-hmm.
And then another question for her that I had is, why did she feel that some of the agencies were short-staffed in regards to creating job placement opportunities for those that are willing to go out into the field now?
And because the providers have been laying off because of not having the billable hours to bring in, and that's what we're hoping that we can circumvent those issues by bringing in some dollars that would allow that to take advantage of this opportunity, and support the providers.
Great. And that would be addressing what Adam was talking about in regards to moving the age 2027 into a telephonic service for the moment.
I'll let him speak to that, Adam.
Well, just saying the dollars, I guess,
Right.
maybe.
Right.
And then I wanted to just review as well, Washington State had put out a list of ways to bill for hours that were creative ways to be able to provide services to clients in need. Here at West Yavapai, we're obviously working very diligently with case management and using, up until today, the H2025, if applicable, but if not, we were just using a case management code, especially with families with children right now that have been basically stuck at home, and we're looking for ways and resources, even child support services, which were provided through RSA here in the state, but I understand have not of recent. But we're looking for creative ways to get people back to work and also to engage our clients. And then, and just being able to communicate with our RSA counselors, and because a lot of them are working from home now, or on being able to expedite and facilitate these services. We're just looking for ways to do so during this time. That's about it. Thank you.
Hey, Jim. This is Adam. How are you doing?
Hey, Adam.
Hey, to answer your question, as you know, your question around H2025, the pre-vote code, psychoeducational services. As you know, typically that's only face-to-face. And when we say, we moved it into the into the permanent list, which means that these are allowable right now for telehealth. So for phone calls, for video, Skype, Zoom, any of that stuff, we are allowing it right now. Yes, that's what I meant earlier when I said we moved that over there. Once these times, and hopefully soon, are done, then it'll revert back to normal, where those pre-vocational 8.27 will not be able to be used via telehealth. or
Great.
how the direction we're going in this world. Maybe we will. We'll see. Knock on wood. Let's see what I can do.
Great. Thank you, Adam.
So,
Okay, and oh, go ahead, Wendy.
go ahead, because I think we're running out of time. You go ahead.
We are, and I was just going to say, you know, Kristen has provided some things. Yes, the VR counselors are available. Their emails are still working, so please just email them if you don't have their phone numbers. And Wendy, were you just trying to, yeah, in the last 5 minutes, we'd really like to hear from what people are already doing. A lot of those questions are great. We can put them in FAQ, but Brandy and some of those from Workability, others, anybody want to share some of the great things you guys are doing or other challenges and barriers you'd like for us to address as a state?
Yes, we are at Workability down in Tucson. We are providing our TTE program remotely that we're actually finishing our second week. We have been kind of working through the video conferencing piece we started with Google Hangouts, which was pretty unstable, and then we decided to purchase Blue Jeans, and we've been working with that as our video conferencing platform. And then we've also, each of our members has a Gmail account, so we've been using Google Drive and Google Classroom to facilitate our TTE curriculum. And so our teachers are also are working really hard, very positive, upbeat. They're very encouraged about what our members can do. We do have 15 out of 16 of our members participating. Some of the difficulties are the internet access, in the sense of internet speed can be difficult, and then also between our employment specialists and our members, what technology we do have too. So that's some of the issues. Our teachers are working with our members on PCs, desktops, tablets, phones, you name it. And sometimes it's a couple of the technologies with one person. And so they've been very flexible with that. But it has been a pretty stiff learning curve. And one of the things that we have learned in particular is there needs to be a lot of upfront plan time with our employment specialists to kind of teach them the platform, how to teach remotely. I mean, we've been kind of doing it on the fly, and luckily we have really good employment specialists, that are flexible with that. But we definitely, looking forward in the summer, we really do need 3 or 4 days if we have to go remote, we need 3 or 4 days to train our staff to be ready, and then also be able to get our members on a little bit earlier than our planned, so that they can kind of learn the technical side, so that we can start classes on the first official day of our summer program, versus, because it's taken our teachers about a week and a half and our members to know and understand the expectations when it comes to technology. And so being able to bill up front with DDD and be able to provide that training is really important. And also the other question I had when it comes to DDD and rates is that to provide this remote training, Workability is providing a lot of technology. And if there's any movement on rates that can assist in that would be great. And so some of that compensation would be really helpful. The other question is when we have members who don't have the right technology, or they don't have, a new enough technology, is there a way DDD can help support those members to be able to participate with the technology?
Okay, thank you so much, Brandy. With only a minute left, and we kind of figured, an hour is a lot for all this. We'll blend ideas. We really appreciate if you guys send us anything that you're doing in addition to the chat box. We'll pull everything together, and we'll kind of look at next steps. We have talked about putting out some webinars potentially on virtual supports to really delve into it, because we didn't get to that as much. And I have a list of like 15 things I've learned over the last couple of weeks I think would be great for us to think about and share. And So there's a lot of things that can be done with the individuals in their homes. You guys have a great opportunity to work with families because they're all together, like person-centered planning activities and discovery. So with that, I'll let Wendy close us out, and we're so grateful for all of you. Do you have a few minutes to say anything else, Wendy?
Yes, so thank you. We really wanted to do this longer, but we knew, you know, everybody is so busy and we wanted to get the conversation started. So that's what, I mean, today was just fantastic to hear everything. And I'm really excited. This is such a challenge. I mean, it's difficult and things change by the minute and we're all trying to adjust, but there's opportunities, and that's what we can build on this, folks. And I think when we come out of this, we can have another paradigm around how we're providing services and being more effective. And the UCEDD wants to support the agencies and the providers and everybody out there. So what we would like to do, if we'll make them available, put it that way, is to have these weekly and we'll bring in, you know, webinars. We'll do different things that are helpful, but we'll also have the opportunity for us to share with each other and use this as a platform. And also, Jeff, can we create a listserv out of this so we could use it for everybody to stay in touch with each other as well?
Absolutely, yes.
Okay.
I have all of the, thank you all for, you know,
All right.
sending your emails with the registration, so thank you.
Okay, so we will send out the recording. We will respond to the questions and get them out to people. And if you have other ideas or questions, if you want to respond to the listserv, or if you want to email Susan or myself directly, or Jeff, to be able to get that answer for you, or we don't have all the answers. I mean, we're doing this in real time as much as anybody else, but we want to be responsive and we want to take advantage and we want to make sure everybody is supported to the best that we can do that. So, you know, just share it with us, share your ideas, share your questions. We'll try and get those answers from everybody and we'll keep this conversation going. Thank you so much. You all are just doing an amazing job, and you know, Arizona is just great. Look at our state agencies and look at all of you that are providing services. It's just, it's just really terrific, and I appreciate all that you're doing. So thank you.
Thank you all so very much. We'll be in touch, and yes to all of your answers or your chat. I can see everything in there, so. We'll get everything out to you all. Have a great weekend. Be safe.
Hang in there. Bye-bye.
Bye-bye. Bye-bye.